They are the hidden heroes working on the front lines right now to save lives during the pandemic, and that means battles beyond the virus. The staff at University Hospital sees patients suffering from addiction almost every day. Today, one of them is a recovering addict who is thanking the team for saving his life. Tonight, Gabrigadis is telling us about his turnaround.
Michael Standiford is 46 years old now and pursuing a college degree in Florida. But before that, he suffered from drug and alcohol abuse for 30 years of his life.
And then there was times I was there twice a week overdosing. And then I was there every couple days I was overdosing.
After being in and out of foster care, Standiford from Jeffersonville started using drugs when he was 13.
Almost immediately after I started doing meth, I started experiencing meth-induced paranoid psychosis, and that's what got me in and out of your hospital so much.
It almost killed him.
And there were several occasions where I would eat 3 or 4 8-balls, and that's a lot of drugs. That's enough meth to keep you up for 2 months.
In May 2018, he was shot. A few weeks after, he ended up back in the hospital bed because of an overdose.
And I'll never forget this one lady. I wish I knew her name, but I went in there and ma'am, I literally had vomit in my hair. I had threw up and fell into the vomit. And the lady still was rubbing my head, and she said, "Michael, it's going to be okay. It's going to be okay." Because I was on the verge of death. I've been dead before. I know what it feels like when I'm dying, and I was dying. But her care saved me. It saved me because I felt enough peace. I don't think that's even part of her job description, you know.
He recently sent this note to the hospital staff saying if it wasn't for them, he'd never move to Florida to become sober for 2 years and pursue a degree in psychology.
You know, even when I didn't care about myself, they cared about me. You know, I had given up, but they never did. And thank God for that.
It's so powerful, and we don't hear enough of these awesome stories.
Dr. Martin Hecker says during the pandemic, UofL Health has seen many patients suffering like Standiford once did.
Drug overdoses and visits for substance abuse and also psychiatric illness kind of went up. People are under more stress. People cannot get to medication-assisted treatment or like medications for opioid use disorder.
Standiford plans to use his story to reach people who are in the shoes he got out of.
What you guys did, it doesn't just help me because it put me on a path to where I want to help other people too. And that's why I'm taking psychology, and that's why I'm pursuing a career in the addiction industry.
For WHES 11 News, I'm Sanait Gabrigadis.